Honorable Minister of Information and Culture, Permanent Secretary, Directors here on the Ministry of Health, gentlemen and ladies of the press, good afternoon. This is the press briefing from the Federal Ministry of Health in respect of the COVID-19 response in Nigeria. An update for Monday, the 23rd of March, and as of this day, we have recorded 36 confirmed cases of coronavirus disease in Nigeria. Of these 36 confirmed cases, 25 are in Lagos, 6 are in Federal Capital Territory, 2 are in Ogun State, 1 in Edo, 1 in Ekiti, and 1 in Oyo. 26 of them have had travel history to countries with a high burden in the last 2 weeks. 6 are contacts of the confirmed cases. And for 4 of them, we have not been able to trace recent travel history or trace a known confirmed contact. Unfortunately, we recorded the first death from COVID-19 infection in the country. This was a Nigerian who had underlying illnesses and died due to the complications on the 22nd of March 2020 in Abuja. He had just returned from treatment in the United Kingdom. In summary, as of today, the 23rd of March 2020, 36 cases have been confirmed in Nigeria. 2 have been discharged after successful treatment, and 1 death has been recorded from COVID-19 in Nigeria. Of the presently 33 active cases, 32 are clinically stable with mild symptoms only, and 1 patient is dependent on oxygen. The Nigeria Center for Disease Control is working closely with state governments of all affected states in Nigeria to carry out intensive contact tracing. Through intensified contact tracing, we have been able to promptly detect many cases. I strongly urge all health facilities to be on high alert from the state, local government, law enforcement authorities, and community leaders and private hospitals to fully cooperate and to be able to inform the NCDC through the dedicated number of any case of someone who has fallen ill and has recently been out of the country in the last 14 days or has been a close contact of someone who has been out of the country. Following declaration of a pandemic by the World Health Organization and the increasing spread of COVID-19, the federal government of Nigeria, through the Presidential Task Force on Control of COVID-19, has employed diverse strategies to interrupt and halt the spread of the disease. To this end, a ban was placed on all international flights effective from today, the 23rd of March 2020, with the exception of emergency and essential flights. These were not easy decisions to make, but have become necessary in view of the changing development in our country as we witness more and more confirmed cases coming from outside the country. More measures may be instituted by the federal and state governments in coming days as the situation will demand. Contact tracing, that is to say, finding the contacts of those who have been outside the country or those who have been in contact with them, is to identify all persons that require medical attention or require isolation. The Federal Ministry of Health is working with states and presidential task force to review response activities and institute measures to protect the health of Nigerians. The Multilateral Emergency Operations Center, led by NCDC, continues to coordinate national response activities. NCDC has also launched a communication campaign that is titled Take Responsibility. This is a call to all Nigerians and residents of Nigeria to join forces and be proactive in taking greater individual and collective responsibility in preventing and controlling the spread of COVID-19. I urge all citizens and all businesses and all professional bodies, media houses, and all committed Nigerians to take ownership of this campaign by developing and communicating prevention messages around all the criteria that we have listed. Frequent hand washing with soap under running water or using an alcohol-based hand sanitizer. Coughing or sneezing using a tissue paper or using a handkerchief or into the sleeve of your shirt or dress if you do not have this, and disposing of your handkerchief or your tissue promptly. Avoiding large gatherings and close physical contact. Cleaning all surfaces frequently with disinfectant. Getting information only from official sources. Self-isolating for 14 days on return from international travel. And call the emergency call number, which I will repeat, 0800 9700 0010. And if you develop any symptoms or any distress, call that number. Very importantly, I urge all Nigerian residents to take self-isolation and social distancing very seriously in order to prevent the spread of this disease in our country. Social distancing reduces the risk of someone who you do not know may be infected or who may not know that he or she is infected from infecting someone else. Therefore, ensure you maintain at least 2 meters, which is about 5 feet of distance, between yourself and anyone who is coughing or sneezing. Stay at home if you feel unwell and have any complaints that make you suspicious of your health. NCDC hotline, as I've said, is available round the clock, day and night. You can call at no cost. It is toll-free. So we urge all citizens to use this line only for legitimate purposes. This is not for joking. The fight to contain COVID-19 is a call for collective action, and we call for collective responsibility on all sides. We will maintain real-time updates on all new cases through the COVID-19 ncdc.gov.ng platform and continue to provide updates as and when they become available. The Ministry of Health reiterates its commitment to ensuring the control of COVID-19 outbreak in Nigeria, and your full cooperation and support in this fight is needed. To the media, this change in venue, as I've said, is in response to the advice we are giving you now to observe social distancing, avoid crowding. We will migrate to more digital platforms for future briefings to further reduce potential exposure for us all, or find conducive atmosphere to do the briefing and give you the opportunity to ask questions, as we shall do now. Thank you. Questions. You can ask questions from where you are.
Please go back to where you are. Okay, take your camera if you do so well. So you can ask your question wherever.
Tell the moderator to take control. She's
Please
not
make
talking.
it brief.
Okay, all ministers.
No, I will not take it. No question will be taken. Listen, no question will be taken unless you obey this simple instruction. Very simple. Please go back to where you are. Whoever wants to speak will give the fellow a microphone and it will be heard. Please go back to where you are. Thank you.
You have been given an advice I will expect you to follow. You can ask your questions.
Honorable ministers.
You have the microphone. Please just ask. We'll pass the microphone to you. Please.
Okay, good afternoon, sirs. My colleagues, good afternoon. Now, I'm seeing where we are now in the country. Okay, my name is Hassan Zagi, and I write for the authority newspapers. Now, seeing where we are in this country, what do you think, sir, we need to adopt forced isolation?
Repeat it, please.
Seeing where we are in this country now, we have many cases. What do you think we need to adopt forced isolation?
Forced isolation?
Yes. Force.
Enforce.
Isolation.
Good afternoon. My name is Ogom from AIT. Honorable Minister, I want to ask, like my president said, we are seeing what's happening right now. What about those at the grassroots? What measures are we putting in place for them? Thank you.
Honourable Minister, I'm saying that the last time you briefed, you mentioned that you have a number of items on your shopping list, health equipment that will help in curtailing this virus. Could you just mention if you have received some of the consignment? That's one. And two, you were talking about 350 ICUs. Are these ICUs in the isolation centers? That's another one. And again, I just want to find out from you. You could not tell us the number of respirators that we have in the country currently because you were talking about moving one to places that are quite important. Are you considering getting them now that we're having in-country cases? Thank you.
Thank you. Good afternoon. My name is Chima Nwankwo. I work for Rise News. Honorable Minister, I want to ask you, generally, what is the state of preparedness, our health facilities, concerning the fact that this thing, COVID-19, based on events that happened over the weekend, is real and is here now? What's the state of our health facilities and how prepared are we for an outbreak? Thank you.
Thank you. I will start with that last question. Since the news of this...
Excuse me. Look, there's nothing new in this. Just had one. But please go back to where you are. Gentlemen, please go back. Honestly, you're talking about discipline, you're talking about enforcement. And we cannot even ask you for simple social distancing. Then how do we want to convince the woman in the market that what we are saying is real? Please, could you go back to where you are?
Okay, so we'll go to the last question from the last question. Of course, preparedness. Since news of the outbreak of COVID-19 came out in Wuhan, China, the Ministry of Health has been preparing, has been looking at the situation, studying the situation, looking at the spread of it to other countries, and looking at our own resources. And at that time, we requested for support from the federal government, and we got the support, financial support, and started preparing and procuring. We have bought some of the things that we're looking for. So the preparedness started long ago, but I always told you this is called the novel coronavirus. People didn't quite understand it very well. The behavior and the pattern of the illness is becoming clear with time, and all countries are adjusting to what they see and what the disease picture begins to look like. So we are doing the same. And many countries have been caught off guard in that even countries with very, very strong health systems have almost looked like they are facing collapse. We are focusing, and we have focused always on two things. Number one, containing the disease, and number two, preparing for it. Those are the things we have been doing so far. And also hoping that we do not get so many cases coming in. This is, as I said, an imported disease. It's not local. We add that to the question of the grassroots. This is something that came in from outside the country. We are hoping it does not get to the grassroots. That's why we do a lot of contact tracing. We are going after those who traveled from outside the country and finding out if they had it, this came with this disease or not. We put them in self-isolation. Those who are from high-burden countries are on supervised isolation. And if after the expected incubation period, nobody tested positive, they are free. Those who are testing positive in that period are taken into isolation proper and given the treatment until they are well. We hope that by that it does not filter to the grassroots, but if it does, we have the primary healthcare system and the disease notification that goes along with it. We are prepared for that eventuality. We have also been working with the various other ministries under the Presidential Task Force on control of coronavirus to see what effect it can have in other areas and how to cope with those effects. The items on the shopping list, yes, we have received money, we have received some of the things. We have also placed order. As I speak to you now, we are expecting some deliveries. And I'm just coming from a meeting with multilateral partners, the various UN agencies who have promised to support us, both with procurement and with logistics and technical support and training. Other countries have also offered to support us. And when I leave here, I'm going to meet with the ambassador of another country who's going to offer us support. So we are well with support from our partners and friends and other countries. Respirators, we have pulled together the respirators we have in all the facilities, the public facilities. I cannot give you a figure right now, but we're also in touch with the private sector to know what number they have in their stores. We are also looking at even those respirators that may not be functioning to have them repaired and put them on repair. That initiative is already mentioned. And as for forced isolation, we have not come to that yet, but we have had on occasion to go after persons who came from abroad and did not register their presence and we believe did not go into isolation. We published their names and until they volunteered themselves and were put under observation. And after the 14-day period, they were now free to go. That answers that set of questions.
Okay. Honorable Minister, my name is Fred from The Sun. As regards when the Turkish airline arrived some days back, he told us how many that have been traced and contacted. But as the case keep increasing, can you just tell us maybe how many have been traced and contacted and maybe reached out to? That's number one. Then the second one has to do with the isolation center. I was at the Gogolada own at the weekend when the news broke. In fact, there was a pandemonium at the hospital. Doctors were running for scared patients. In fact, some said, let me go and die in my house instead of being here. Because when they heard that the confirmed case were arriving at that place, everybody just picked up a thing and want to be discharged. Can you tell us how ready? Because I was there. The permanent building is under construction. The one that is the provisional one is under serious renovation. How soon or fast can we get those things? Because in Abuja here, we are having increased cases, and that may be doom for us. Thank you.
Good afternoon, honorable ministers. My name is Rabi Abdullah. I head the health desk at the NTA. I have 3 questions. One has to do with one of the cases that you said is oxygen dependent. Which of the states, where is the case? Is it in Ogun, Ekiti, FCT, Lagos, or where? Secondly, I'm aware of the fact that you received a letter from human rights lawyer Femi Falana urging you to look the way of Cuban doctors in view of the drug that had emanated from Cuba and said to be potent in the treatment of COVID-19. What's your take on that? Because we know that the Cuban doctors did wonderfully well in the wake of the Ebola virus disease outbreak. On the last note, we know that, and I think that's what my colleagues who had asked questions earlier on wanted to find out. Self-isolation. There are a whole lot of people who have traveled out of the country and returned, but are not observing self-isolation. How do we bring about that? What should we start doing with such people? Because most of the cases recorded so far were imported cases. And I had asked earlier on too regarding testing. 5 laboratories not well distributed across the country. Now our cases are rising. And it is pertinent that we test, then carry on the rest of the job. What are we doing in that regard and in terms of test kits? Thank you.
Good afternoon, Honorable Minister. I am God's Gift. I write for Business Day newspaper. Please, I would like to know what efforts have been put in place to curb the spread of this disease at IDP camps, and also, going by the trend with the rise in cases in Abuja and Lagos, is the government considering closing our land borders?
Okay, now I think we'll take that question. The last question is not related to the health sector. The Presidential Task Force on Control of COVID-19 is a presidential task force that brings together all ministries, all disciplines, the health sector, aviation, immigration, customs, interior, and so on. The humanitarian ministry and all the ministers who are Minister of Information, as you can see here. They will give information on the government's strategy in areas outside of health. So let us limit ourselves to the health sector. And the question of border you will hear about later on. Now, with regard to laboratories, when the COVID-19 epidemic broke, the only laboratory that could take the diagnosis was in Abuja. As a matter of fact, even that laboratory did not have the reagent. And our strategy that we developed at that time was that if we had any sample, we'll have to send that sample to Johannesburg because that was the closest we knew. Until we got the reagents, and then Abuja could do the test. And then we shared the reagent with Lagos, and right now 5 can do the test. Within a few days, there will be 6 laboratories. So you can see that we are building the capacity and increasing the capacity little by little according to the resources and the offers we have. We have an offer for a new PCR machine, which we are going to place further somewhere else in the strategic location. But all this is possible because we have an excellent courier system that can take samples from one place to the other. So a sample taken in one place is taken to another place and processed. And I just heard from one foreign diplomat that in their country they have only about 5 testing centers. The important thing is not that you have a testing center everywhere. It is that you are able to do your tests. And even if you are able to send the samples from one place to the other place and get your result in time, you are okay. Now, your 5 testing centers are no longer sufficient if they are overloaded. So if you have more samples than you can test, then you need more laboratories and more assets. But if you're able to take care of all your tests with a good courier system, with a good delivery system, in 2 or 3 laboratories, you are okay. So in our own system, we are expecting that if the cases rise, we need to be able to increase the testing opportunities. Therefore, we are still going to have more PCR machines. It's not that at the moment they are not working or they are not adequate, but for the time to come, we need to have these PCR machines, and not only have the PCR machines, we also need to have the reagents that make them work for this particular disease pattern. And we're also aware of the fact that these machines can be used for other disease patterns as the situation arises. Now, the question of the Cuba and the drug, there are issues with medicines that are coming up. Every day I receive texts and phone calls of people who told me that they have the medicine to cure corona. Some of these calls come from a country where corona is not even known to have already appeared. How they got the cure, I do not know. But we depend on the World Health Organization, who are working day and night, analyzing all the treatment options that come up. We are looking at what other countries are doing. We are looking at what choices they are making. We are looking at their situation. We are looking at and comparing with our situation. Our situation and their situation are not the same. And we're trying to be sure that we take the best choices that are available for our own country. Anybody who wants to copy another country will make a mistake. Therefore, you have to have something tailor-made for our situation and for our country and for our peculiarities. Any medicine that is new that comes out, we'll look at the results and the reports on it. I've recently heard that one of our treatment centers is preparing to treat if the situation arises with chloroquine. That is what we call a clinical trial. It's not that it's routine. It's that he wants to be able to add to the body of research to see, does it really work or not, before you can actually add to the body of knowledge and say this one helps. Now, the question of self-isolation. This is a social responsibility of every citizen. Everything can be done by government. Citizen engagement is important. And anyone who has traveled, who may have come with an infection, who may not know that he has that infection, has a responsibility as a responsible citizen to protect himself, his children, his family, by being self-isolated. Now, we depend on that sense of responsibility of every person. And if you are not able to self-isolate, take a hotel. I have heard of people who say, no, my house, I'll get too many visitors. They will want to see me. He goes into a hotel for the 14 days. So we do not hope that we need at some point to enforce isolation. That was a question that was asked earlier. But we want to depend on the sense of responsibility of all citizens. We are very much engaged in risk communication on the media. And one of the reasons we hold this press conference is to also have opportunity to address citizens, to address viewers, to address listeners, and to be able to use the questions you ask to respond to the anxieties they may have. So therefore, we continue this briefing on a daily basis, and we may have to give special licenses to the reporters who come to see us because of the crowding, special pass, so that you can report on alternate days or whatever it is. We shall work that out. But we want to use this medium to reach the citizens, to reach the populace, and to give proper advice so that nobody is depending on fake news or on news that is incompetent from incompetent sources. I think that's it. Next questions, please.
Honorable Minister, sir, my name is Friday. I'm a reporter with Channels TV. I have 2 questions. The first one has to do with a recent tweet from the coordinating agency, NCDC. A few days ago, on their Twitter handle, they said they are working under difficult circumstances. And that is the team you are leading. What are actually the difficult circumstances that you are working under at this time? The second has to do with the briefing you gave some days ago where you said the federal government is expecting some test kit from Jack Ma. What is the current state? Have we received those test kits, or we are still expecting them? Thank you.
Yes, next one, please. No more? Okay, good.
Good afternoon, honorable ministers. I am Joseph Kadri. I report for ITV. My questions will be based on the papers. Circulated. Okay, sorry. My question will be based on the papers circulated. I see one person can infect 2.5 million people in 5 days. God forbid, 2 persons infecting 5 million in 5 days. So, the first question, why are you not considering advising the head of service, secretary to the government of the federation, or even Mr. President, to make an order for everybody to stay at home, at least for 1 week? Second question, just last week, the NMA briefed, and they scored you very, very low on preparedness and on proactiveness. But they said they will work. The point is that they need PPE to work with. Do we have enough? Should we have 2 people infecting 5 million? Question 3, sir. On our isolation centers, should we have 2 persons infecting 5 million? Do we have enough centers to carry 5 million people? Sir, question 4. I ask you on the second week of this usual update that what about if someone who is infected is coming through the land borders? You said it's not possible because it's usually an air thing, a flight thing. But we have had a case where the person came in from the land borders. So what are we doing to ensure we tackle this issue, especially when we have porous borders? Let me pause for now. Thank you, sir.
Okay, well, first of all, there's quite a lot of misinformation in what you are saying. A lot. I did not say that land border is impossible. Those of you who have watched the briefings we've had have said, you will recall that I always said that the most likely point of entry will be by air, because the origin of this pathogen was in China, it has moved to Europe, and it is from Europe that it is coming here now. Not one ever came from China directly. So the question of land border was never closed. We just say that doesn't seem to be a priority. But it did happen. And when he came in, he was found and discovered. He was an adventurer who was motorcycling around, I presume trying to motorcycle around the world, and they came into Nigeria and was found there. Now, I would like you to understand this thing properly. You don't understand it, so read it properly. I will explain to you later on. But it is not, there's nowhere there where it says 2 persons infect 5 million. You didn't read it properly. This piece of paper talks about the social distancing that the Honorable Minister of Information was stressing to you just now. Stressing, very seriously. And here it says quite clearly that 1 person can infect 2.5 people in 5 days, depending on the exposure. Okay? So the exposure is what he's talking about. If you have no exposure, if you have a lot of exposure, or if you have 50% less exposure or 75% less exposure. So the less exposure you have, the less the number of people who can be infected. Now, that question immediately goes into the man who's asking about stay at home. Social distancing means you stay apart so that if 1 person has it, is coughing, sneezing, it doesn't immediately enter your face and you breathe it in. So if you are far apart, the risk for every person is less. And that's why we are also advising against overcrowding. We are advising against congregating in different places. Put away all parties. Some countries have reduced congregations to 50. Others have reduced it to 2, not more than 2 people. So it is a question of reducing your risk. Therefore, if we are going to close down a country or close down a service, it is the government that decides that based on the risk assessment. You look at the risk, look at the number of infections you have, look at the possibility of it spreading, and then that decision is taken at a different level than this one. So, you have to wait for the Presidential Task Force to also be able to brief you on the deliberations that have come from anything outside of the health sector. Now, I have not seen what the NMA did. They have not spoken to me. Since this whole activity broke out, they have not come one day to come and visit or to come and ask what they can do. We would like them to do that and come and find out how far we are going. They have not been. I'm a member of the NMA, but we have not heard to say, well done, how can we help you? Other countries have asked us, other agencies. In fact, right now, the United Nations invited us to all these agencies to find out what we can do. Now, PPE is what you get if you are going to be engaged in something. It's not a T-shirt that you distribute to everybody. If you are going to be engaged in a particular activity that puts you at risk of coming in contact with the infected people, that's where you put on PPE. So you can't sit in your house and say you are looking for PPE to be distributed to you. That's not the way it goes. These things are expensive. They are procured from abroad. And we want everybody to take a serious and mature approach to fighting this problem. It's a matter for all of us, for all Nigerians. It's not for anybody in particular. It's not only for the Ministry of Health. In fact, we have advised that that some states issue a call for retired doctors and nurses to be able to be reabsorbed and come back to service for this particular activity if the need arises, as the situation arises. Retired doctors and nurses can be recalled for back to active duty. They are a reserve pool. As for the donations, today we heard from one of the United Nations agencies that the donation from Jack Ma has already arrived in Addis Ababa. They delivered it in Addis Ababa, which, as you all know, is the headquarters of the African Union. And from there, it is going to be distributed to all the African countries who were named. I don't know the exact number, but they are distributed from there. What Jack Ma did was to deliver it to the African Union headquarters, and there the distribution will take place. Today I was informed that our home will come within the next few days. Now, with the regard to the tweet from the NCDC, I do not want anybody to misunderstand it. The NCDC is working at very high capacity. They are doing a very good job. Some of them do not sleep. I personally, I call the CD many times a day. Sometimes I call him up in the middle of the night. I wake him up from his sleep. Maybe I'm one of those making things difficult for him, because I worry him to get all the information I want and to give him suggestions and tips as to what to do. So if he says that we're living on certain times, yes, they are under very great stress, I will say that, but that is exactly what they are trained for, and they are coping, they are doing very well. They are going to be increasing the number of people who work for them, increasing access to more transportation. They are the ones leading the contact tracing, and they are the ones guiding most of the responses that the government is doing from the Ministry of Health. So don't misinterpret that uncertainty to mean anything that is negative. It is they're doing a very good job. It's a positive thing that they are intending to let you know. Thank you. I think we'll take the last batch, if any, and then we'll disperse.
Onyebuchi, I work with these newspapers. The Honorable Minister, I want to draw you back to the incident that happened yesterday about the death recorded. I've read about some insinuation surrounding his death. Maybe you could clear the air on how the health officials responded to his own case before he died. Secondly, you said that presently we do not have drugs for managing this COVID-19 case. Now, what happens to those that are taken to isolation centers? What is being done to them? Do we just put them there and leave them or watch them? What treatment, what kind of treatment do we give them? On the final answer.
Well, first of all, I did not say at any time that we do not have drugs. I didn't say so. So what I told you is that we are buying more supplies, we are buying more things. This is a new virus, the novel coronavirus, and those who are having to deal with this case, whether in China or in Italy or any other country in the world, they are trying a variety of medicines. The first and most important thing are what we call supportive treatment. Supportive treatment means that if the person is dehydrated, you put him on IV drips, you give him painkillers, you give him vitamins, you give him all those things to support his system, to build up an immune system. Because at the end of the day, it is his personal body immune system that will deal with the virus. Now, some doctors, some clinicians are trying to, we just spoke of chloroquine a while ago, to see if chloroquine will actually arrest the growth of this virus inside your body. There is report that it happened when you tried it outside the body. That's what we call in vitro test, where it seems that if you try it outside in a laboratory, it seems to work. Now, whether it actually works inside the human body is yet to be proven. There are other doctors here in Nigeria. What we used was the drugs for HIV, which we used, antiretroviral drugs, which we used. And those drugs were used on this patient. But we also told you that by scientific observation so far, up to 80% of people who suffered from infection of COVID-19 do not get sick or get only mildly sick, which means they didn't even take any medicine at all, and they were well. So whether those antiretroviral drugs cure the patient or not is still a question mark. But you give because you want to try it, and a lot of learning comes from this kind of treatment. So if you have a very desperate case who looks like they are getting clinically very unstable, you begin to try many other drugs, including antiretroviral drugs, and other countries, as you know, are trying to develop vaccine against it. But that will take quite a long time before it becomes a reality. So I think the land border, I think I've answered that. The man who slipped in has been caught on the road, and I think that's all. I've looked at my list.
The man who died.
Yeah,
the question about the man who died.
Well, as I told you, the person who passed away had underlying diseases. He was receiving treatment for something else, and of course, the medical confidentiality will not allow us to disclose the name or the illness he had, but he had underlying illness. And that is exactly the pattern they have seen in other countries, that most of the fatalities, most of the people who died in other countries had underlying diseases. They had either TB, or they had cancer, or they had HIV/AIDS, or maybe they were so old also that their body was no longer building enough immune antibodies in their system. So if your body is not able to build antibodies to tackle the virus in your system, those are the people who largely have succumbed. And this particular patient may have belonged to that category.
Honorable Minister, the next question. Sir, between last Friday and today, last Friday, when my name is Duro, I report for Blueprint. Between last Friday and today, the figure has risen from 12 or 15 to 36. In China, where this dreadful disease originated, sources said that in the last 4 or 5 days, there has been zero, there are no new cases of coronavirus. Now, sir, the question is this. I think I should ask. We are still in the rainy season. And, we are still in the dry season. now the rainy season is about here. What we are told, two of us, which I hope you confirm, is that coronavirus survives or thrives during cold season. We are about entering the rainy season, sir. Even when we are in dry season, where it cannot, where it is not supposed to exist, we have such an astronomical growth from within 5 or 4 days, between Friday and Monday, it rose from 15 to 36. Now, we have reason to be afraid. We are about entering the rainy season. Thank you.
Yeah, good afternoon, Honorable Minister. My name is Moses Emorinken. I write for the Nation newspaper. Sir, we know that it is in our best interest if we have a flattened curve of spread. By that I mean that we do not have large cases all happening at the same time. Now, if you notice what have happened in the trends that have been happening, we've been having all these cases increasing. And now this means that our state and federal facilities are going to be burdened if this continues, if we have a large, numbers turning out like this. I want to know very, very simply, what are we doing? Are we working with the private hospitals? And if yes, what are we doing? Because these people are the ones that can help to provide the necessary support that we need to contain this if we get to that point. Thank you.
Okay, so I have to go. I have an appointment coming up, which is overdue. I will just answer those ones very quickly. Now, there are also many more. As for the 36, I want to remind you again that this disease is not indigenous to this country. The pathogen is not. 26 of those ones were brought by other people into this country. Okay? Now, of those 26, that's 26. 6 have been definitely connected to some of Nigerians who are here, haven't contracted it from somebody who came from abroad with it. That makes it 32. 4 have not been directly proven yet. Maybe they had a contact which they didn't know. Maybe by mistake. That's why we're talking about social distancing. If you are here and anybody who is here now tests positive for corona at any time in the future, within the next 1 week, they say God forbid, which is correct, you will not know where it came from. You don't know because you don't know if the man who's next to you just came back from a high-burden country. You don't know. So those are the reasons, because when you are doing contact tracing, you can only trace the people who the person remembers haven't been near. But some of them may not know their names. Okay? So, and others may have been simply by mistake. Maybe in the church. Or maybe during a party. So that's why we're talking about social distancing as an additional measure to arrest the spread by mistake, definitely not deliberate. And that's social distancing is a very important part of the strategy that we are using. Now, by the time it starts transmitting from person to person within the country, then you have a problem that's really arising. That's why we want to arrest it at a very early stage so that all those who may have been contracted, who may have contracted it from a traveler, are found and put in isolation and cured. And that's the way we can most easily reduce the number of cases that manifest in our country. And that's exactly also the reason why we can flatten the curve, the man who's talking about the curve. I spoke to you about the Italian man who came in. In less than 48 hours, he was identified. The contacts we found for him were 179, and they were tracked and monitored. Out of that 179, 1 was positive. He was immediately also put in isolation, along with the index case, the Italian. Both of them were cured. Both of them have been discharged. Now, if other cases had not come into Nigeria, that would have been the end of COVID-19 for us. But other cases came in. So the ones that have come in are different cases that were not part of the first one. So that's why we're telling you that you don't compare what we have now with what is going on in China or in Italy. But if we don't take time and move fast, we can be heading in something dangerous like that, because they are transmitting among themselves, not only imported cases anymore. So we want to get all those who may have been infected now, because we know that if we don't, it will be a serious burden on our health system. That's when we are going to be looking for ventilators, looking for that, looking for. But if we can arrest it at an early stage, we may not need so many people on ventilator. So that's why we need your cooperation to identify all those who may be contacts, who have traveled, and some people are hiding. Some will not report for whatever reason. Or some say, oh, it's not their portion. Maybe it's not, but it's better to go to control the situation by knowing who came back from abroad in last 14 days and what contact they've had, so that we can monitor them and make sure they are well. Nobody's going to be asked to pay anything. Nobody's going to be arrested. Nobody's going to be punished. You can continue your business from isolation. So therefore, we are pleading with those who have traveled and have returned within the last 14 days to report. I also want to let you know that the majority of people returning now are Nigerians who have come, many of who have come with COVID-19. So they are not Chinese, and they are not all Europeans. They are not Italians anymore. I mean, they can still be, but with the closure of our, if we close the airports in the country, then maybe we reduce the inflow from abroad of new cases. Then we have to deal with the ones that are here with us. And maybe if all goes well, with the cooperation of everybody, we are able to deal with those ones, then we have achieved what we call containment. And then we don't need all these intensive care and so on. So you need all those things when things really get out of hand. And we don't want to get to that level. In order to succeed in that, we have to work very hard. And all of us will cooperate, and all of us will be very disciplined. That's what the Honourable Minister of Information has been stressing here today. I would like to hand over the microphone to him so that they can also put his own words of advice in. Thank you very much, everybody, for listening.
Please.